Hi, this is Dr. Bharadwaj. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will look into one of the important disorders that are feeding and eating disorders. Feeding and eating disorders are somewhat common disorders we see in general public. So we will look deeply into it. First one is in order to understand feeding disorders, you have to understand where we are describing these feeding disorders. So you can see one of the important diagnostic and statistical manual for diagnosing the psychiatric diseases is a DSM-5. DSM-5 is diagnostic and statistical manual for mental disorders. It is a classification system and diagnostic tool. So in order to classify mental disorders, or you have to, in order to diagnose the mental disorders, you have to have some basis for it, authentic basis for it. That authentic basis is DSM-5. DSM-5 is developed by American Psychiatric Association. This is the world leading psychiatric association who are all included in this association. There are psychiatric practitioners, research scholars who does research on psychiatry, who practice psychiatry with their patients, and also academicians who are teachers, who are scholars, and who are professors, lecturers. All those come under academia. So where is this located? This American Psychiatric Association is located in Washington DC, USA. They have released DSM-5, that is a diagnostic and statistical manual, how to diagnose a psychiatric disorder and how to classify a psychiatric disorder under this heading, that is DSM-5. DSM-5, you can consider this as a book. It was released in 2013, and the latest update to DSM-5, that is known as DSM-5 TR 5th edition, is released in March 2022. It has many changes compared to DSM 5, which is released in 2013. What are the major changes? These major changes includes they have added many new psychological disorders. They have updated the codes for the linking between DSM-5 and ICD-11. ICD-11 is also one of the classifications that is given by World Health Organization. It is for all the disorders. If you want to classify any disorder in the world, you use ICD-11. But specifically, if you want to diagnose psychological disorder, most people use DSM-5 than compared to ICD-11, because this is specific for psychological disorders. Even though ICD-11 has all these disorders, but most of the people or psychiatrists use DSM-5. Whatever we are going to discuss about eating disorders and anxiety disorders are from this DSM-5. Of all the sections, important section is section 2, diagnostic criteria and codes. So DSM-5 has 4 sections. In that, section 2 is the most important one for our discussion today. Section 2 is the important section for DSM, where it has diagnostic criteria and codes. These codes are to communicate, or every disease in this world has to given a code to understand it easily. It has both the diagnostic criteria of all the diseases, psychiatric diseases, and codes given for psychiatric diseases. And also there are linking codes between DSM-5 and also ICD, ICD-10, ICD-9, ICD-11. All those codes are given in this. In section 2, it is divided into chapters. In that chapter 10 is the important one. In this you will have feeding and eating disorders. In that chapter 10 we will look into all these details. So what are eating or feeding disorders? First, it should satisfy some criteria. Disturbance in eating related behavior. So everyone has, there is an expectation from the society, or there is a normal behavior while we come to eating. So you should not eat less, you should not eat more, whatever you want, how much you are, how much ever you want, or what is the timing of eating. All those considered as normal behavior. So if there is any disturbance or a deviation from the normal, what an average person eats or how an average person eats, and if there is a deviation in a particular person, that is known as disturbance in the eating related behavior. Altered consumption or absorption. So if you are eating more, if you are eating less, or if you are eating in the time it is not specified to eat in an appropriate place, or if you are eating in a wrong place, all these considered as consumption or absorption. Even the absorption, if you are not able to absorb the food you have eaten, it also comes under eating and feeding disorders. The important thing you have to remember is impairs physical and psychological health. Physical health means you will become weak or you will become obese, and also psychological health means, so if you are not psychologically fit to eat, or if you are behaving abnormally from a normal person, and you are showing the signs and symptoms of an abnormal person from the psychological perspective. All these considered as feeding and eating disorders. These are the important characters. One is disturbance in eating related behavior, altered consumption or altered absorption. When it impairs your physical health or psychological health or mental health, those are included under feeding or eating disorders. Coming to the various disorders that are given in DSM-5 TR 5th edition. First one is pica. Second one is rumination disorder. Third one is avoidant slash restrictive feed intake disorder. Fourth one is anorexia nervosa. Next one is bulimia nervosa. After that, binge eating disorder. You have other specified feeding or eating disorders, and also you have unspecified feeding or eating disorders. So we will look into all these disorders one by one, what they mean and how homeopathy can help you in treating these disorders. We will look deeply into each of the disorders. First eating or feeding disorder in DSM-5 TR 5th edition is pica. Pica is eating non-nutritive material. Non-nutritive material includes most common non-nutritive materials are chalk pieces, eating mud, taking sand, or eating the wood pieces. I have known a woman who comes to me for treatment. What happens to her is she wakes up in the middle of the night. She goes to her bike and takes some petrol and she drinks it. So whatever the substance that are not supposed to eat, and if a person is eating, that is known as pica. And this should be at least 1 month to diagnose this as pica. If it is one time or two time in a year, so that is not considered as pica. If she is regularly doing it for more than 1 month, that is considered as pica. Pica is a common thing which can happen in other disorders like other intellectual disability disorders or developmental disorders, neurodevelopmental disorders like autism spectrum disorders. It can be the most common is schizophrenia. So schizophrenia patients also where they have altered sensorium, even they are indulged in this pica, and some of the nutritional deficiencies and also pregnancy. We see in lot of movies or also in our houses that when a woman is pregnant, she is uh, longing to eat some chalk pieces or slate pencils. Those are the most common one available. So just in front of my clinic there is a bookstall. There is one person sitting in the bookstall. He says that he always keeps the slate pencils on the desk. I asked so him, why nowadays no one is using slate and slate pencils, why you are keeping this slate and slate pencils? He told that many of the women comes to him, at least two to five women comes to him every day and take these slate pencils to eat. I was shocked after hearing that, and this is one of the common disorders, especially in women, tend to eat more slate pencils. That is considered as pica. Next one is rumination disorder. Rumination means, see, you have observed goats or cattle, they eat food throughout the day. Evening they go to their place and they sit there and they regurgitate the food. They get back the food to their mouth and they rechew it. In same way, some human beings do it. They take the food out into their mouth, they rechew it. After rechewing, two things can happen. They can re-swallow it, they can take it again, or also they can spit it out. So I have seen both kinds of patients. Some patients re-swallow it, some patients chew it and spit it out. So if they rechew, whether they re-swallow or re-spit it, it is considered as rumination disorder, and this also should be there for at least more than 1 month. Then it is considered as rumination disorder. Normally it happens in animals like cattle, buffalo, but some human beings do that. That is considered as rumination disorder. Next one is avoidant or restrictive food disorder. There is no problem with these patients, but they don't like or they don't have interest to eat the food. When we ask the reason, they should say, I did not like the color of the food, or I did not like the flavor of the food, I did not like the taste, I did not like the smell, or I did not like the texture or consistency of the food. This is due to sensory aspects of the food. It can lead to severe weight loss. Their lack of interest, if it leads to severe weight loss, then it is considered as a avoidant or restrictive food intake disorder. There are other features of this disorder, that is enteral feeding. Enteral feeding is they don't like color, flavor, taste or consistency. What they do is they will put a tube into their mouth and they will directly inject the food into their stomach. I have seen these cases also. So with a tube, or else they don't want to eat the food. They always depends on the nutrition supplements. They take lot of vitamins. They take lot of protein powders. They take lot of fiber and all those things. They directly take. They don't want to take the food into their mouth, or they don't want to chew. Because of this, they don't like color, flavor, taste, or odor, or consistency. The important thing they do, most of the people do, is they just put a tube and inject the food into their stomach. This is known as avoidant or restrictive food intake disorder. Then anorexia nervosa. This is one of the common one, especially in women of teenagers. It is common in teenagers. What happens in this is these girls are afraid of gaining the weight. They don't want to gain weight, even though they are less than minimally expected. For example, if the girl has the weight or body build less than for her age or less than for her height, even though she is already thin, she is already skinny, she doesn't eat because fear of gaining the weight. That counts this anorexia nervosa. Body weight less than as per sex and age. Every sex or every age person should have particular amount of weight. So even though they are less, they don't want to eat because they are afraid that they will gain weight. Even though there is significant low weight, they are already low in weight, but still they don't want to eat and they still want to reduce the weight. This happens especially in teenage girls. This is known as anorexia nervosa. Then one of the common disorders is bulimia nervosa. In bulimia nervosa, what happens is there will be a binge eating. Binge eating means they will eat more. So binge eating is considered as if you take large amount of meals compared to others within 2 hours. Before 2 hours, you have taken a meal, and within 2 hours, you are taking a large meal, which is so large that compared to average person of your age, of your gender, you are taking more. Then it is considered as binge eating. So it is average, it is larger than average what other people eat, and lack of control over eating. They do not have any control. Whatever they see, they want to eat. This is binge eating. After binge eating, what they do in bulimia nervosa is compensatory behaviors to prevent weight gain. So they eat much than quantity. They eat full. They eat more than what an average person eats, and they don't want to gain weight. Then what they do, they use laxatives means any substances that increase the frequency of the stool. That is known as laxative. They eat well and they take laxatives, though, so that they think that they can pass the food whatever they have taken from the stool. So they take lot of laxatives or diuretics. Some people think that if I avoid more urine, if I take out more urine from my body, they think that their weight will reduce. That's the reason they use the medicines that increases the urine frequency and they increases the urine quantity. That is known as diuresis. Self-indulged vomiting. They eat full and they go to washroom and they induce vomiting by keeping the finger into their mouth or by taking salt water. I have seen a case where she eats full and she goes to washroom and she takes salt water so that everything comes out. That is induced vomiting. Or fasting. They will fast for so long that they become emaciated, and they land into lot of health problems. Fasting after binge eating is known as bulimia nervosa. Not only fasting, some people do excessive exercises. They spend lot of time in gym or they spend lot of time in exercise. Then that is considered as bulimia nervosa. Even some people take medications, weight loss medications after binge eating. So all this known as bulimia nervosa. You can diagnose bulimia nervosa when this behavior is there at least for 3 months. If it is less than 3 months, you will not be diagnosing as bulimia nervosa, but if it is more than 3 months, then you can diagnose it as bulimia nervosa. So often they say that when we ask them, what they have to tell is, it is I am doing this because I don't want to gain weight, or I want to lose weight, that's the reason I am doing, or I did not like the shape of my body, I want to get my body into shape, that's the reason after eating I am doing all these things. That is considered as bulimia nervosa. So you have to remember, this is an important thing. Why they want to do that? Because they want to maintain the body shape or they want to maintain the body weight. These are the two important reasons they give after binge eating. Why they use laxatives that produce lot of motions, loose motions, or diuretics that produce lot of urination, or self-induced vomiting. This can be by putting the finger into their throat, or it can be by taking lot of salt water. Some people fast. They people fast for 3 to 4 days after eating full. Some people are indulge in excessive exercises after eating full, and some people take medications or any other forms to bring the food out, or to take out the weight from the body, to reduce the weight of the body, or to get in shape for their body. It is considered as bulimia nervosa. Next disorder is binge eating disorder. So what is this? If any person is eating immediately after 2 hours, for example, a person is taken a full meal now, within 2 hours he is taking one more full meal, and the quantity of the next meal is more than an average person eat. For example, the patient has certain body weight, certain body type, and he belongs to a certain gender, and if he eats more than the same body type, same gender, and same physiology person, it is considered as binge eating disorder. So within 2 hours, and he takes the food larger than an average what other person eats. If you are taking a meal excessive than what other person of your same kind eats, that is considered binge eating disorder. He lacks control over eating. He cannot control whatever he is eating or drinking. He always eats, and also eating more rapidly. He eats quickly, not an so when we go to lunch, we eat normally, right? So we take food and we chew it, but these people eat more rapidly. That is considered as binge eating. Even though they are full, their stomach is full, they are uncomfortable, they are about to vomit, they are about to go to washroom and pass motion, still they eat it. This is considered as binge eating disorder. Next one is other specified feeding or eating disorder. So when a person eats excessively, and you think that that doesn't come under any of the diseases mentioned in the above slides, then you can classify it under other specified feeding disorders. But the physician has to give the reason why not diagnosed as any of the above or any of the previously described disorders. If he can give reason X, Y, and Z, so then it is considered as other specified. The physician is specifying why he is not able to include this disorder in the any of the previous disorders. If he gives the reason, then that becomes other specified feeding or eating disorder. When the physician is not able to specify, so he is considering it as a feeding disorder, but he is not able to diagnose which type of feeding disorder, as we described in the previous slide. He is not able to find out the reason, or he is not able to give the reason, then it is considered as unspecified feeding or eating disorder without any specific reason, but he have the symptoms but cannot be qualified as disorder, then it comes under unspecified feeding or eating disorder. So the two important major fear of the patients when they have eating disorders and they want to take allopathic treatment or English medicine or Western treatment, one is side effects, next one is efficiency. There are no medicines in other system of medicine as efficient as homeopathy. All the two fears are annihilated in homeopathy. Homeopathy medicines, when we treat eating disorders, will not have any side effect, not even single side effect they have, and it is more effective than compared to any of the system of medicine on the planet as of now for treating the eating disorders. Fidicus Homeopathy offers you two types of treatment. One is online treatment and in-person treatment. Online treatment, we can take an audio call or video call with you, whichever is comfortable. And if you have any reports, you can share with us. If we need any other further investigation, we will let you know. You can do that locally and send the reports to us. Based on that, we will ship the medications to you wherever in the world. If you are in India, it takes 3 days. If you are in US, it takes 4 days for you to reach the medicine, and it takes 5 days any other country than US. So make use of it. If you want to reach us in person, you can contact the nearest branch, and you can call to this phone number. +91 is the country code, 7997101303. You can call us and take the appointment and come to the physical branch as well. Why Fidicus Homeopathy? Fidicus Homeopathy has the highest chance of health, and for feeding disorders, we have the highest success rate. You will get the transparent treatment and you will get the personal care. That's the reason you have to consider Fidicus Homeopathy for eating disorders. Thank you.